the reason why this brought up, why this jumped into my head is because, like, for example, one of the things we do is we build AI agents, and you have to go so fine grained sometimes with what it can do and what it can't do for it to actually get good results. Now, I'm okay to hallucinate when it comes to, I don't know, just writing a LinkedIn post or writing a blog post, for example. Right? You can figure that out. But when it comes to medical, obviously the stakes are a lot higher. Is there any types of AI innovations that you're aware of in the industry? And is this also something that, from a cybersecurity standpoint, you're opening up to and you're now also pivoting towards or embracing?
AI in MedTech is a big thing today. I think we're too premature for AI in this industry because the risks are super high. And we do test AI from a cybersecurity perspective for data poisoning and all the things we test for. I don't remember them all, but it's not the testing. It's typically the model is flawed from our experience. And we do look at the model. An example, and this may change the industry, an example that's happened recently is there was a AI-based wellness app that could provide therapy for you. So there's a suicidal patient chatting with AI, it recommends therapy. And after a couple months, the AI wellness app told the patients, it said, well, you might as well go ahead and kill yourself. And the patient killed themselves. So of course the patient's family is suing the manufacturer of this product. So I think we're not there yet when it comes to AI in med tech. And I realize there's different use cases. I think with image enhancement, which is a big use case, it'll take like an ultrasound or an X-ray and enhance the image to look at your vascular system better. I think in that situation, it's okay. But for like wellness apps and things like that, I don't think we're ready for AI. There's too many edge cases that haven't been thought through.
No, I think I definitely agree with you that it's a scary thing, like a small hallucination or a small, wrong nudge in a different way. This was a user talking to it, but imagine if it had access to actually operating devices, for example, which could have devastating effects.
Mm-hmm.
Now, understanding that AI has, I would say right now, just limitations, because I think you said it well. It's the foundational models, right? Whether they hallucinate too much or they don't follow guidelines as much, they're just not reliable, right? You can run a test 10 times and you get a different result every time, which is kind of scary because it's not deterministic.
Right.
So AI is definitely good at code, for example. Well, it's getting better. I'm a developer myself, and if I look at AI code, like sometimes I have to laugh out loud, as they say. And sometimes I'm like, oh yeah, that actually just helped me just get to my destination so much faster. The more you ask of it, the worse it gets. It sucks. But is there any types of AI that you guys are using when it comes to testing, when it comes to automating things, or maybe when it comes to writing code? Like, for example, you get a device and you get the software, you run it locally. Is there any type of AI that you're using to analyze the code, or if there's proprietary information, keep that to yourself? But that's a range where I potentially could see it as a benefit to get more productivity happening. But at the same time, you have to be conscious of the cost of quality. But is there any innovation there?
We use the AI that's part of Notion. So we can ask, okay, we have this device with these interfaces. Tell me all the test cases that are relevant. So we can use it for things like that, but we still have to manually check it. We also use AI for a lot of our content generation. We have all of our company information fed into like a customized chat GPT, where it can write like us, it knows how to write like us, it has all our source content, and so it can create content that sounds like us. So we use AI in those regards, but we don't use it like for testing. We have a manual tester do the testing.
Do you see that changing in the future? Well, maybe the answer is a default yes, but are you confident that you're going to be making, you're going to be able to embrace more AI, let's say in the next 2 years? Or do you feel like the medical space is really going to take quite a few years before it embraces it more?
I think the medical space needs more time to embrace it. And this is a bigger challenge, because if you have a diagnostic system that can detect cancer, as example, you have to
Yeah.
look at how you train the device, the model. If you show it a million images of something benign, like a benign sample of tissue, and then you show it 1,000 that is malignant, it's going to be predisposed to say it's whatever it sees as benign, as example. So you have to have the right data to train the model. And then the other challenges is, where do you get that data? Because not every country gives up that data. So now you've trained it on a model. You train the model with
Yeah.
data that's specific to a certain demographic. Because I can't get data from Europe as easy as I can from the United States. Definitely can't get it from China as I can from the United States. So now, if I have a Chinese patient, that model has not been trained on
Right.
that person. So there's all these things that we don't really think about, which is why I say we're a little bit premature
Yeah.
for using AI
Interest-
effectively.
Yeah, because there's everybody always refers to AI is better at identifying malignant skin spots than a doctor's, like 70% hit rate. But it's like, yeah, but does it work on every skin color? Does it work on every type of patient? That's because it infers things. Like the human eye goes a little bit deeper than a biopsy, even goes deeper. But I think you make a very fair point that there's still a lot to be. But the progress is going fast. I mean, if you're talking images, for example, we just had a new model drop from Google and another one from ByteDance as well. They're amazing when it comes to images. So I think the technology is going to get there at some point. But yeah, if you're going to ask me, Sean, who would you like to check your little thing on your skin, for example, I'd be like, nah, give me a doctor, not an AI. With this type of knowledge, 100%, I would trust more a human than an AI. But love them to use it as a help. And I think a lot of medical people still use ChatGPT or any type of AI just to do some basic research, some ground knowledge or anything else. But I understand it's difficult to embed it actually and to make it part of a core product.
Yeah, but I mean, there's also a push to use more AI for like surgical robots, for example. Right now, there's a doctor that has control of the surgical robot. In the future, they're trying to push to where I have an autonomous surgical robot and remove the doctor altogether. So now if something goes wrong, there's no one to intervene, which to me is super risky.
Yeah,
Even
you
like a
won't get there.
Waymo car. I live in Phoenix, Arizona, in the United States. We have autonomous driving cars, and I feel totally safe taking them. I've taken probably 100 of them, but I think there's still a capability because there's always a human that you can push a button and talk to. That if something goes wrong with a car, a human can take it over remotely.
And it does. It happens quite a lot that these humans have to intervene. Even Tesla robotaxis are now doing, having a human driver in there as well, assisted. But and imagine like a car is one thing and you get to trust it, but surgery is like a completely different level of complexity. And I hear you on that. I think we're years out on any types of actual implementation on that side.